Hi everyone, in this video, I'm going to be going over a case report that basically teaches you about a specific neurological disorder. So in this video, what I've done is I've created a case report that's basically from my own creativity, but it's based on actual case reports that have happened, right? So basically, yeah, let's get into it. First, let's read over what it's saying, right? Patient X is a 20-year-old male, okay? Oops. Let's go back and turn on annotation. Yeah, there we go. He's a 20-year-old male, who presented in the clinic with primary complaint of bouts of nausea. Okay, so I'm gonna change this to a little bit thicker, and I'm gonna highlight that in yellow because that's symptoms, right? So bouts of nausea, which seems important. Before long spells of staring, abnormal tastes, twitching in the fingers, twitching. Seems important. So then after that, he complains of memory loss, increased fatigue, and difficulty speaking. So memory loss, increased fatigue, difficulty speaking. Okay. And he has feelings of lower than usual, and he's unmotivated. Alrighty. Okay. So now let's go over the vitals. His BP seems to be a little bit higher than usual. He's actually, I think, 140/90 is hypertension. Okay. Then his heart rate is a bit slower than usual, but I don't think that's unusual. His temperature seems to be slightly elevated, but that can happen sometimes. They can be normal fluctuations. And his weight, from my calculations, he has a BMI of exactly 30.0, which means that he is obese. Okay, so let's move on to the next slide. So yeah, this is what I saw here. I'm just showing you why. Let me explain why these symptoms are a little bit alarming to me. Okay, so the first thing is his age. Now, a 20-year-old male, 20-year-olds are not the oldest people, so a young person is having these issues, right? It means that it's not due to aging, it's due to some external factors. So he's a young person, which is the first red flag. Second one is staring, abnormal tastes, and twitching. So basically, let's think about it logically, right? When you're staring at something, that means that staring is a little bit vague, but you'll understand why staring was a little bit of a red flag for me. We'll see that later on in the video. But onto that, abnormal tastes. So the brain processes tastes, right? When you get abnormal tastes, your taste buds won't taste things wrong. They'll send input to your brain, and your brain determines how they taste, right? So abnormal taste means that there might be something neurological going on. And twitching it means certain jerks. They're basically electrical impulses, right? So to me, this points to neurological issues, right? So neurological issues. And especially since we're not given any previous, like, he's mostly healthy. We're not giving any familial issues. That seems a little bit alarming to me. He's saying memory loss and difficulty speaking. Now, these are red flags on their own. First, because he's so young. A young person should not be having these issues. These are more commonly seen in people with dementia or people who are who are a little bit older, right? He also has fatigue. Right? So fatigue, that's not normal. And difficulty speaking, that's definitely a red flag. And he seems to have mild symptoms of depression. We can't classify it as depression, but he feels lower than usual, which is mental health is a big indication. And yeah. So lower than usual, which means that this is really having an impact on him, and this is not. And so he has hypertension, which is not good, right? A 20-year-old should not be having hypertension. That's a red flag a little bit. And he is also obese, right? So that is self-explanatory why that is kind of concerning. Okay. So now let's talk about the topic of this video. This is known as seizures, right? So first of all, what are seizures? Seizures are what are known as bursts of electrical activity in the brain. So let's take a little bit of a quick understanding here. In your brain, you have neurons that tell other neurons to fire. So they're like green, right? So they give them the green flag to fire, right? These are called excitatory neurons. Excitatory neurons, and they make up about 80% of the neurons in your brain, right? And then there are inhibitory neurons, which basically give a red flag to not fire, right? So as you can probably guess, these make up 20%, and they're called inhibitory neurons. Oops. Inhibitory neurons. Okay, they're called inhibitory neurons. So as you can tell, there is a lot of interaction between these two to create learning, to balance out learning, because to fire, if your brain is consistently firing, that means you're not doing anything, but you're not stopping yourself, you're not inhibiting yourself, which is bad, right? Because to learn, you need to know whether to that something is right versus when something is wrong. And that's only possible when some neurons fire and others neurons don't. So they balance out learning, they play a role in keeping your brain working efficiently, so efficiency and all of that. So why would these bursts of electricity happen? When does it happen? Well, scientists actually have a lot of theories as to why seizures can happen, right? But usually, the most common cause is an imbalance of inhibitory and excitatory neurons, right? So let's think about this in terms of common sense. Your brain, if it's firing and it's not firing right now because it's so controlled. Some tell your brain to fire and others tell your brain not to fire, which means that your brain is not consistently firing. It has breaks in the middle. But what if there's an imbalance of that? What if there's more telling you to fire than there are to telling you not to fire, right? So that would mean that there's consistent firing or a lot of firing happening all at once. What this creates is it creates a large amount of electrical activity in that area, right? So creating that amount is really bad, and it's like an overworking of that area. So that's what seizures are. So what is epilepsy then? So what epilepsy, let's switch to text now. Epilepsy is called a spectrum of seizure disorders classified as two or more seizures without any underlying cause. Okay. So let me move that a bit. Basically, let's think about what this means, right? So epilepsy spectrum epilepsy is a spectrum. So why is it called a spectrum? Because nobody really knows what causes epilepsy. That's what it says in the definition, right? It's two or more seizures without any underlying cause. So you don't know what's going on. You don't know what's causing the seizures, but they're happening over and over again. So that's what epilepsy means, right? And so there are multiple types of seizures, right? So first, there's focal, which means it only starts in one place in the brain, versus generalized, which means that it happens in multiple parts of the brain, right? So, okay, why am I telling you all of this? First, let's actually talk a little bit more about seizures, and then once you see this, you'll definitely understand why I'm telling you this. Okay, so first, let's talk about the types of seizures, right? Because when you understand the types, you understand which ones are more severe, which ones will cause more damage than the others, so on and so forth, right? So your first type of seizures is generalized seizures, which means that it occurs all throughout the brain, right? Generalized, which means all. So in that, you have petit mal or absence seizures, or grand mal or tonic-clonic seizures. Okay, so think about it this way, right? Petit mal means that it's just small bursts of electrical activities, right? In all over the brain. It's called absence seizures because the person, when you're looking at the person having a petit mal seizure, you'll usually see a few seconds of rapid blinking and a few seconds of staring. It looks almost as if they're absent from the real world, right? And then grand mal seizures are called tonic-clonic because you literally, it's so much electrical activity all over the brain. It causes you to fall down, cry out, and maybe even lose consciousness. So how I like to think about it is grand mal seizures, these are the things you envision in movies, right? Where people have foam coming out of their mouth and it's really, really intense, right? So that's why it's called grand. It's like grandeur. Whereas petit is like, it's bad. It's all over the brain, but it's kind of subtle. You can't tell that they're having it. It's small. Petite means small, right? Then there's focal seizures, right? So focal seizures are basically, they're simple. They're only in one area of the brain. They're specialized, right? So focal seizures, there are two types, simple focal and complex focal, right? So in simple focal seizures, people usually only have twitching, strange sensations like weird smells, tastes, or feelings. And in complex focal seizures, people are often confused and they're unable to answer questions, right? So then there's one last type of seizure called secondary generalized seizures. So what this means is that it starts out as a focal seizure. It starts out in one area and slowly spreads to all areas of the brain. How is this possible? Well, when information travels from one neuron to the other, they usually, or one area from the other, they usually travel through nerve tracts, right? So the nerve tracts, they will transmit the electrical current, which will spread it to multiple parts of the brain, causing a whole network of electrical activity, right? So it basically starts in one area and spreads to everything else. That's why it's called secondary generalized. Okay, so now what you can probably understand is that you could probably understand why I'm telling you. This person seems like this patient X, he has twitching, right? He has twitching, strange sensations, weird smells and feelings, right? So those are all the key hallmark symptoms of a simple focal seizure, right? I think from our information that we're given right now, this person seems to have a simple focal seizure. Okay, so now that we understand what he has, we need to confirm our diagnosis. We have a suspicion, but we need to confirm it, right? So how can we diagnose this? So first of all, he says he's having multiple episodes of this. It wasn't just one time. He's had it multiple times. And we aren't given any previous head trauma. We don't understand. There's no other precursor for him to be having these seizures. He's not had any sports injuries. We're not told any of that. And so we assume, like, for the context of this episode, we can assume that no, he doesn't have any of that. There's no significant past history. So how do we confirm this, right? So seizures are usually understood through EEGs. So what's an EEG? An EEG is what's called an electroencephalogram. It records what's called brain waves in your brain, right? Brain waves are created when there's communication happening from one area of the brain to another area of the brain. What this creates is, since the neurons in one group all activate together, they send signals together, and the other neuron group will also activate together. So that synchronization that happens creates electrical waves that go up and down and up and down and up and down, which tell us about the activity. If there's more activity happening in those areas, the brain waves, the frequencies will increase. So frequency means the number of waves in one interval. So you can see here that there's less frequency in this area in comparison to this area, right? So let me write that out. Let me circle it. So there's a little less frequency from this area in comparison to this area. You can see more waves in that one line interval. I'm using this interval over here and this one actually. You can see that there's more waves happening in this one than there are in this one, right? And then there's also the intensity, right? So the intensity is how high. Frequency is how often. And the energy, the amount of activity is determined by the height of that wave, right? If the height is higher, that means there's more energy, right? Because more waves, first of all, there's a higher frequency and there's higher waves, which means that you have to take a lot of energy to climb up the hills and go to run down the hill, up the hill, down the hill, right? So that's why it takes a lot of energy, which means that there's more activity in that area. So, but when you see high levels of activity and compare it in relative to the slower areas, that should immediately click something in your brain. What's the very definition of a seizure? Increased electrical activity, bursts of electrical activity, right? So, okay, that's great. We understand that now. So let's try and understand, because this is patient X's electroencephalogram, right? First of all, let's try and read this. So basically, all we're looking for are increased bouts or bursts of electrical activity. We can kind of start to see that in these regions. So how you read an EEG is that to the side, let's see if I can zoom. I can't really zoom. You have labels here. So see how there's FP, FP, P, T, Q, O. So basically what these stand for are the regions of the brain, right? So P stands for parietal. So just for context, that's spatial reasoning, right? T stands for temporal. That's memory and auditory. F stands for frontal. That's basically personality, etc. And finally, O stands for occipital. So that's like vision, right? All right. So basically, in this region, in these three, you can kind of see an increased burst in electrical activity, right? It's in the temporal, occipital, and a little bit of parietal and occipital lobe. Okay, so that makes sense. We see that our seizures are happening somewhere in your temporal lobe, temporal, parietal, occipital regions, right? So, and that makes sense, right? Because this is, if let's visualize this, say this is your brain from a side view. Sorry, guys. That's a little bit of a horrible picture, but I think it should make sense. say that this is your temporal, right? This is your temporal. This is your occipital. And right next to it would be your parietal, right? So actually, there's a really special regions here which combine all three of them together. So we know that it could be happening in one of these three regions, right? So now what we do is we take an MRI. What this helps to do is it helps to understand if there's maybe a cause for these seizures or maybe a cause for why these epilepsy attacks are happening, right? So first, right off the bat, let's take a look at our temporal lobe because our occipital lobe seems to be fine. We looked at previous MRIs and there wasn't really anything notable. But okay, let's take a look here. Right here, your hippocampus seems to be very damaged, as in it doesn't look healthy. Same part here. You can see white. White usually in an MRI, this is like a special type of MRI. And this one, white signifies electrical activity, right? This piece over here, you signify electrical activity. And honestly, the hippocampus seems to be kind of deteriorated in this area, which means that, and there seems to be a lot of scar tissue here. So what this means is that they have scarring in the hippocampus, right? Scarring, and you can see the activity. So what this says is that the temporal lobe seems very highly impacted to me. So I'm going to say that this is the seizures that are happening mostly in the temporal lobe. Right? You see scarring, you see activity. So this scarring that you see here actually has a very special name. This is called hippocampal sclerosis. So sclerosis, you may have heard from multiple sclerosis, is scar tissue forming, right? And hippocampal, it means in the hippocampus. So let's just connect back, right? We see here that there are temporal lobe activities happening, and that combines with his symptoms, right? He has memory loss, difficulty speaking. So basically, he's having difficulty recollecting his words, he's having difficulty remembering things, and he's having fatigue, and he's been feeling under the weather. That's all functions controlled in the temporal lobe. That's memory has to do with the hippocampus, feeling lower than usual. It has to do with your emotions, and recollecting words for your speech also has to do for temporal lobe. So we understand that it's most likely an issue with the temporal lobe. And so now let's go to diagnosing our patient. So the diagnosis of our patient was mesial temporal lobe epilepsy. Let's break that name down a little bit. Basically, mesial temporal lobe, mesial means medial. Mesial means middle, right? Temporal lobe epilepsy, which means that it's happening inside the temporal lobe. You can see the scar tissue happening, right? So basically, these are epilepsy seizures that occur in the middle of the temporal lobe, right? So that means mid-temporal structures, which are the hippocampus and the amygdala, right? And basically, the symptoms of this are a decline of memory, emotions, mood swings, etc. And this is what we saw with him, right? And usually, mesial temporal epilepsy is associated with people who have childhood risk factors, like they had a brain infection when they were little, or they had a concussion, or they were in sports, things like that, right? And it's pretty obvious, right? So, some treatments would include dietary changes. So, actually, doctors recommend keto diets a lot for people with epilepsy. The reason why this works is actually not well known. Scientists happen to think that fats have a lot to do with it. The high fat and protein content seems to help a lot. On top of that, some experimental practices are surgery, which are basically like they remove a section of your brain, remove the section that causes seizures, right? All right. So it's a section, they remove the section that creates a seizure. However, not all patients are eligible for this because obviously removing a part of your brain is not optimal. And if the scarring has spread to more than your hippocampus, it would be a little bit more difficult to remove and things like that. All right, guys, so that was it for this video. I will put the link to the presentation in the description, and I hope it helped you guys. Thank you so much for watching. Bye.